Alrighty, good morning, Pagosa. It's Friday, TGIF and all that. So anyway, this is the Pagosa Springs Medical Center, and I'm really delighted to introduce two new guests that we haven't had on the radio yet, and new here for the most part. So Lauri Medina, MD, General Surgery at PSMC, and Cathy Mundt, the COO, Chief Operations Officer. Good morning, you guys.
Good morning. Good morning.
How's it going?
Going well. Pretty well, thank you.
So you guys haven't been on the radio before, or at least this station, so tell us a little bit about yourselves, your medical background, and how long you've been at PSMC and all that. You want to start, Dr. Medina?
Sure. So I've been fortunate to be working with Pagosa on and off for the last 7 years, and I am a general surgeon, as you said. I trained in Denver, and I've gotten to spend the majority of my medical career in rural Colorado.
That's cool. And surgery, that's great. Everyone seems so excited that you're here, so I just want to pass that along. I've been getting a good vibe on that. So,
and then very excited.
Yeah, and Cathy, you're the COO. That's a big job.
Yes.
Operations.
I just took over for Kathy Douglas, who had been here for probably about 14 years, I think. I moved here about 2.5 years ago from Iowa. It was a very good move. I've been a nurse for 32 years. A lot of that was in surgery. A lot of management. I came here as the surgery director and then moved into the COO role, and I'm very excited.
That's exciting, yeah. So tell us a little more about what it's like to work here and the surgery. Maybe we'll talk about the surgery department.
Great.
Dr. Medina.
Well, one of the reasons I keep coming back to Pagosa, and I'm really excited to be spending more time here in the near future, is just the amazing staff, not just in the operating room, but throughout the hospital. And it's really a privilege to work in a place where you wouldn't hesitate to have any family member come in for any procedure. You'd never want anybody to spend a night in the hospital, but certainly the quality of the staff, the facilities, everything is top-notch. And what's exciting about working in a smaller community is you really get to have that personalized relationship with your patients from beginning of a diagnosis throughout the treatment and the aftercare as well. And that's always been the reason I've stayed in smaller communities.
Yeah, it's a great place.
I've worked in large and small hospitals, and I'd say that I prefer smaller hospitals just because you have, like you said, a more personal touch, because we can spend a little bit more time with our patients.
Right.
We have a great group of people here that want to live in Pagosa because they enjoy this area, so they choose to work here. And they got great attitudes and give great care.
What city in Iowa did you come from?
I moved from Washington, Iowa.
Okay.
I grew up right on the river in LeClaire.
Okay. Mm-hmm. Nice. But yeah, Pagosa's awesome.
Yeah, it is.
You know, I can't imagine living anywhere else. Yeah. And we've had some great weather, and we're building that snowpack and the moisture. All that, you know, it's going to be a beautiful spring when we get there. But anyway, so let's get back to surgery. What types of surgery are offered here at PSMC?
Well, one of the great things about being a general surgeon is we treat all different kinds of conditions. Certainly, as a practicing female surgeon, one of the things I really enjoyed helping with is helping women who have both benign and malignant breast conditions. And Pagosa recently introduced a new mammography unit, which is state-of-the-art. We have a phenomenal radiologist that can do minimally invasive procedures. And then if you need to actually have an operation, the OR team is great support for that. In addition to that, I would say Pagosa offers a full range of all kinds of intestinal services, from prevention with things such as endoscopies, screening, and treatment of, once again, both benign and malignant conditions. Certainly in the mountains, it's really hard to find dermatologists that can help you with different kinds of skin issues, and we can certainly tackle some of that as general surgeons. With Pagosa's Infusion Center and the oncology presence here with Dr. Buck, it's really fantastic to be able to offer treatment that patients would previously have to travel for right here. And if people do have to go somewhere else, there's really great collaboration with larger institutions, really good communication that occurs. And lastly, while we certainly hope that we don't have to meet anybody listening in the emergency department after a trauma, with Pagosa's trauma program, it's really top-notch there.
Yeah, several months ago we spoke with the EMS, and last month it was primary care, and so it's quite a team you have here that you're working with, and how does that work, interaction with primary care? And I guess, this is kind of the next level after primary care, right? I mean, that's how it works.
Well, and I think one of the great things, like Kathy mentioned, being in a smaller hospital, the communication does not rely just on electronic communications. You walk down the hall, and I might see the primary care provider for the patient I just operated on. So we all get immediate feedback, which again, when that primary care provider runs into the patient at the grocery store, they know what's going on with their patient. And I think that makes patients feel like there really is continuity of care, and as Kathy said, it's personalized. So it's really, whereas other places, practices exist in silos, I would say that doesn't happen here.
Yeah, it seems like a real team here,
It is very integrated.
And that's what I guess Angela's talking about when she calls it value-based care connection.
Right. Instead of, looking at making sure you see a patient every 15 minutes in the clinic, we give our patients the time and the attention that they need, and don't just push them through so that we have as many numbers as we can. We want to look at that patient as an individual.
Right. So there's pre-admission testing, phone calls. The phone number at PSMC is 970-731-3700.
That is correct.
Right, and that's the main number, and that works well. You can also look at the website, pagosaMedicalCenter.org. And so what is pre-admission testing? How does that work as far as, I see that on here.
So every person that is scheduled for surgery will get a phone call from our pre-admission testing nurse, and we review their chart and make sure that everything looks appropriate for them to have surgery. If they've had a heart condition in the past, we'll make sure that they get an EKG to take a look at their rhythm, make sure that they're I don't want to say perfectly healthy for surgery, but that we've looked at everything. We've looked at their cardiac situation, their respiratory situation. Is there anything that we need to consider beforehand or get them checked out before they have surgery, just to make sure that we are doing the safest surgery that we can, and we're not going to put them in peril by doing surgery because we missed something. We look at their medications, their health history, their social history. We look at an awful lot of things before we say, okay, yep, we think that you're ready and you're safe to have surgery.
And state-of-the-art equipment and all that here.
Oh yeah, we try to maintain for the services that we provide. We try to make sure that we have the best equipment, the most up-to-date equipment, and we work with really good vendors that make sure that we have what we need. Especially with Dr. Webb in orthopedics, we work a lot with Stryker. And they are very dedicated to us. When we call with the need, they make sure that they come out. They really respect Dr. Webb and what he does here. So we always make sure that everything's up to par, everything's clean enough and sterile. We have a lot of checks in place that we make sure that we go through before every single surgery to make sure that everybody's on the same page and we're doing the right thing.
That's great. Well, I mean, it's a beautiful hospital, so I imagine everything is top-notch here.
And Kathy, I think in addition to state-of-the-art equipment, the approach you described is really a state-of-the-art approach. We know now that just like a cancer treatment is individualized to an individual person, their particular tumor type, we know, as you said, that if a patient's what we call perioperative, the time before surgery, the time after surgery, if that care plan is set in place, individuals will, if they have to spend the night in the hospital, they'll be able to leave sooner, their infection rate will be lower.
Correct. Yep.
If we can optimize their heart and lungs, because not everybody can be brought back to perfect health, like you mentioned, but most of us have a state of what I like to think of as optimal health. Mm-hmm. And that's a state-of-the-art approach with the discussion around, we've all heard the words rehabilitation. If you hurt your knee, you need to rehab your knee. Well, now for surgery, the conversation is around prehabilitation and getting
Correct.
people as fit for surgery as they possibly can.
Right. We look at everybody as an individual and make sure that they are truly ready.
Mm-hmm. Well, Dr. Laura, Kathy, let's take a quick break, and we'll be back. We're going to thank our sponsors for bringing us Good Morning Pagosa on this Friday morning. So stay tuned, folks. We'll be back with PSMC in just a minute. We're back. Good morning, Pagosa. And we're here with the Pagosa Springs Medical Center. We're actually at the medical center today, which is great. I like, getting out of the office a little bit. And we're visiting with Dr. Lauri Medina, the general surgeon here at the hospital, and Cathy Mundt, the COO. And, I've been here a while, and I've seen all of this, this evolution from nothing, basically, not even barely a clinic, to what we have now, which is just a really impressive hospital. And we're so lucky because, really, most of us probably don't want to go to Durango to take care of some of these things. So let's talk about that a little bit. Why wouldn't we want to go to Durango? Obviously, I think it's pretty obvious when I come here, but tell us a little more, maybe. Kathy, you're laughing.
Well, I think that we can provide as good of care in Pagosa Springs with the services that we provide that they can in Durango. Every hospital has the same basic rules that we have to abide by to provide good patient care, and I believe that we can do that here in Pagosa with just a bit more of a personal experience because we are smaller, so we can spend a little bit more time with our patients.
Yeah, that's good. Dr. Medina, what do you think?
Oh, I agree. I feel like my personal commitment to my patients has always been that if I'm going to do a procedure on you, my commitment to you is that it's going to be done as well right here as it can be done anywhere else. And clearly, every place has limitations, and certainly if something exceeds the scope of this particular hospital, I don't think anybody has any qualms about helping you get the best health care wherever you need to go. At the same time, if you and your family can be cared for within a few blocks of where you live, that's the best circumstance. We know you'll recover faster, you'll be closer to your regular docs, you'll be closer to your family and the things in the place that you care about, and we know all those things contribute to your healing, whether you're getting your hip replaced or you just had your appendix out. It doesn't matter. We know the things that go into helping people heal are being in a surrounding that you care about, surrounded by people that care about you, and that's how real healing happens.
So you're
Very
not
well
a number.
Yeah,
right?
exactly. Exactly.
I know we have telehealth and all that too, but like you're saying, it's nice to see someone in person, and
like you said with the telehealth, we do reach out and try to get as many services as we can. We may not be able to have that physician here, such as telehealth, but we can use those resources and still get the patients the care that they need. I've worked in very, very large institutions, and I can say that, I never left one floor because it was so big. The CEO didn't know my name. I didn't know who they were. And Rhonda knows everybody here.
Oh, yeah.
You know? And she cares about everybody here as well. And I think that that's one thing that we can offer as well. We want to be here. We want to be in this area. A lot of the staff come from other places where they have a lot of experience, and they bring that experience here. They bring experience and new ideas for things that we can do and improve as well. Just like Dr. Medina coming in here. You know, she's a great addition to our surgery team.
Yes, that's what I'm hearing.
Yeah, we're very excited.
That's cool. Well, last month we were with the primary care folks, and they stressed the team approach too. It was interesting because they had it seemed like they had that down. So I mean, it just trickles all through the organization. Yeah, it's awesome. So. Well, great. Anything else? I know you guys are busy, and I really appreciate your letting me come over here and interview you two, and I've had some fun.
Thank you for coming over. It was great.
Of course.
Thank you very much. It's nice to meet you.
You too. And take care, you guys. Have a great weekend, and thanks everyone for tuning in to Good Morning Pagosa.